Nutrition is an important piece of cancer treatment. Dietitians can work with patients and their caregivers to achieve optimal nutritional status while minimizing the effects of treatment. Nutrition is also an important piece for cancer prevention. I'm Katt, dietitian at Tammy Walker Cancer Center.
Let's start out with talking about your work with the cancer patients.
So the first thing that I want to do is look for any nutritional deficiencies that they come in with, or look for any impairments that might make it difficult for them to eat. So that is common with any tumors that invade the head or the neck, so maybe esophageal cancer or throat cancer. So food has a hard time passing through. Sometimes those patients end up with tube feeds, and sometimes we can modify their diet, so maybe a soft diet or a liquid diet to get them through. The next thing I would talk to the patients about is their protein intake. Protein is the most important nutrient for cancer patients for a variety of reasons. The big thing is it supports their immune function. Secondly, protein prevents muscle loss. And so we want to avoid any weight loss, and patients should almost double their protein intake while they go through treatment. And lastly, with protein is it promotes healing. And so protein is the nutrient that our body uses to synthesize new cells and tissues. Another thing that we look at with my cancer patients is treating any nutritional deficiencies. So a big side effect of chemotherapy treatment is it kind of depletes their electrolytes. And so we want to monitor with regular lab work and replete things like potassium and magnesium. Another big one would be what we call dysphagia. And dysphagia means difficulty swallowing. That could come from inflammation, or again, that can be with the tumor involvement. And so we modify the diet for that as well.
Well, another part of cancer and nutrition is prevention. Let's talk about prevention for all of us.
So as far as nutrition for cancer prevention goes, the current research suggests that eating a diet that's rich in fruits, vegetables, whole grains, nuts, seeds, and beans is our best bet. We need to move away from that sort of Midwest ideal of the meat and potatoes focus at the dinner plate and leave more room for fruits and vegetables. The last thing I wanted to mention, and this is probably the least favorite recommendation, is that alcohol is not recommended for cancer prevention. So if you do choose to drink alcohol, it's recommended that men have no more than 2 standard servings per day and women have no more than 1 per day.
Okay. Well, thank you so much for some great information and for all the work that you do. And thank you for watching. For more information, you may visit TammyWalkerCancerCenter.com and like them on Facebook.